Yeah, I'm Carey Lloyd. I'm a pediatrician, and I've been practicing for 18 years now. Traditionally, diabetes in children, there's two types of diabetes. The first is type 1 diabetes, where your pancreas just really starts to fail in terms of some of the pancreatic cells fail in producing insulin. But what we're really concerned about right now is the type 2 diabetes. And over the last 30 years, something that was virtually non-existent was this type 2 diabetes in kids. And over the last 30 years, we've seen it escalate. So nearly almost now, I'm trying to remember what the statistic was. I think it was like 1 in 4 kids are now being diagnosed with type 2 diabetes. We're seeing it as young as 8 years of age. But the problem is that when they're diagnosed with diabetes, this type 2 diabetes, they have had what's called pre-diabetes prior to that for several years, which goes undetected. They are not alone in not knowing that they have it. 80% of the adults that have pre-diabetes don't know it. So their children don't know it either. And in that pre-diabetic state, what's happening is the cell's ability to take glucose into it is being hampered by inflammation. So the insulin no longer is able to open up that cell, either a muscle cell or fat cell, to let glucose in to get utilized and chewed up. So it sticks around in the blood vessels and causes and wreaks havoc. And so consequently then, it's a failure of insulin to allow, it's what we call insulin resistance, to allow glucose in. So that's directly related to childhood obesity. We know that childhood obesity has increased 100% over the last 20 years, and we're seeing the effects of that, and that's this type 2 diabetes just shoot way up. Children that have type 2 diabetes, unfortunately, will shorten their life by 20 years. It leads towards, early onset heart disease, kidney failure, blindness, and the list kind of goes on and on. In another 15 years, over half of Americans will have type 2 diabetes or be pre-diabetic. We will not be able to afford it. Worldwide, we're seeing by the year 2030, right now there are 290 some odd million people with diabetes. In 2030, there'll be over 595 million people with type 2 diabetes in the world. It's a big problem. As our American diet starts going global, due to industry and profits, etc., we will not be able to afford the healthcare costs. And the sad part is that all this is preventable if we just oftentimes, if we think about what's on the end of our fork and actually eat those foods that are there naturally. Well, we've seen a shift in what we're feeding our kids and what we're consuming, and so it's directly related to childhood obesity, and that's what goes in their mouth. It's directly related to the increased consumption of fast foods. One statistic I saw was that over 50% of American households eat fast foods daily. And so it's, it's a shift in how we see food and how we eat, and I think also shift in some of our lifestyles. So with the family dynamics changing as well as popular media, we're seeing a slowdown in activity rates, we're seeing increase in supersizing, we're seeing the change in the American family and neighborhoods. Additionally, we're also seeing that food costs have shifted. So with high fructose corn syrup being so cheap, then the packaged foods and processed foods are really quite cheap, and sometimes the only food available to some neighborhoods and some people. So they can't get the vegetables and fruits. Thus, it's not necessarily a choice. It's sometimes a cultural issue as well. So unfortunately, there are a lot of dynamics that go into it, but the basic thing is we're consuming a lot of calories that are hidden, a lot of the wrong calories, and less of the micronutrients and good nutrients that are leading towards childhood obesity. They like it, tastes good, they're advertised about it, and boy, it's inexpensive, it helps, it's fast. Well, first there's, generally a family history. If there's a family history of obesity, family history of type 2 diabetes, then the likelihood goes up. There are certain genetic or ethnic groups, Latino, as well as African Americans, their risk for type 2 diabetes is almost 1 in 2. Then the other thing is, if your child is overweight, they're automatically in a high risk for type 2 diabetes or prediabetes. So you throw a family history in there, and then how you're eating, boy, the risk goes way up. And it's an epidemic, unfortunately. Other symptoms, include the type of foods they're eating. Then you start getting into, how much obesity they have. Then the symptoms of diabetes start to include, they have high blood pressure, they start having increased triglycerides, LDL, HDL, your total cholesterol. We can start measuring those, something's called a metabolic syndrome. There are physical signs on the skin that can show that you might be in this pre-diabetic state or this insulin resistance. You start seeing this rash, almost like dirt on the skin in various areas that doesn't wash off. Those are signs of insulin resistance. So you need to, look into and be evaluated for that, for this metabolic syndrome, get the labs tested. And right now, boy, it's totally preventable. And in many cases reversible. So by changing your diet, you can reverse the high blood pressure that goes along with it, change your cholesterol levels, and start coming back down to a normal state. Your insulin starts to work, those cells lose that resistance, and things start functioning. It's interesting that insulin resistance has been shown to exist within hours of eating a fatty meal. Our blood sugar goes up because it can't go into cells within minutes to hours after eating fat. Yeah, that's a hard question to answer, and a good one, in that unfortunately we see that now with 30% of our children overweight. 18% are obese, and it is hard that we're spending millions, if not billions of dollars on trying to figure that out. The easy fix is to change your diet. That's easier said than done, unfortunately. And as we've talked about, costs, accessibility, the desire to do so. But the biggest thing is to I would recommend, try to get with someone who can work with you, a dietitian or someone who can work with changing your diet, so that then as a family you can start making those changes that will be long lasting. And it's not going on a diet, it's actually changing your lifestyle, changing your diet in little ways, a little bit at a time. And eventually, over a year or 2 years, boy, it can be reversed, and they will have so much better health in the long run. You feel better, you have less disease, you come to see me less. That would be great.